Okay, so this is going to be interactive. Ask questions. We get to a page that, man, I don't understand that. Stop. We'll go over it. Our goal for tonight is you leave here knowing at least something you did not know before you got here about Medicare. Okay? All right. So we have to do these two things. So who said it was reading this? I'll stop. This says if we talk about financial stuff tonight, we're not talking about your financial stuff. We're talking big picture. Okay? The next one would be, is that the Social Security one? Probably. All right. So we have to do this for legal reasons. So he's taping it, so we did it legal. We're okay. We're ready to go. All right. Here's what we're going to cover tonight. Medicare basics. Anybody here on Medicare? All right. So we got some expertise in the room. Okay. So we're talking basics. We're not going to be talking about your specific plan. We're going to give you a big picture. We can ask questions, and we kind of get into that. Now, if you brought a device with you, I would highly recommend you go ahead and get the Wi-Fi up, because we are going to get into a website. You can put your information in, not your personal information, not your Social Security number, not your name, not your address. But you can put in, here's the drugs I'm on, here's my zip code, and we'll get to the piece about this is the Medicare Advantage plans that may be best for you or the supplement plans. So you're going to learn how to do that on your own, and we'll show you. Ashton's going to walk you through that. Medicare supplements, I call it Medigap, same thing. We'll cover what those are. Medicare Advantage. About 40% of Americans do Advantage. Do any of you on Medicare have Advantage plans? You do? All right, so we're going to talk about those. There's pros and cons for both, and we'll discuss the difference. Prescription drug plan, how to check your Medicare plans. That's what we're going to go online and do. And then important dates you got to know. Medicare is one of those things in life, if you're a U.S. citizen, you have to sign up for. If you don't, and you choose to sign up later, you'll regret not signing up for it. And we'll show you how, okay? All right, we got the questions. Any other questions you thought of while we getting ready to go? All right. Terms. So you got a piece of paper in front of you that has these terms on them. So CMS, whenever you see that on the news, Centers for Medicare and Medicaid. Now, why isn't it CMMS? There's two M's in there. I don't know. It's a government program, okay? And a lot of people get Medicare and Medicaid confused. Here's you an easy way to remember. Medicare is health care for old people, 65 and over, unless you have a disability. Medicaid, aid is for low income. Medicare, health care. Medicaid, low income, which has health care coverage in it, but it's mainly for low income. Medicare, government program, federal government. Medicaid, state run. You can be on Medicaid in Arkansas, move to Tennessee, and not qualify. So you got to qualify in every state for Medicaid. We are not talking about Medicaid tonight. We're going to talk about Medicare, health care for old folks. Okay? Original Medicare. That's your traditional. That's where every doctor has to take it. Doesn't matter where you go in the United States, they take original Medicare. We're going to talk about Medicare Advantage, often known as MA. That is run by insurance companies. Traditional Medicare is run by the federal government. Which one do you think is more efficient? Well, and that's why Medicare Advantage is often cheaper than traditional Medicare. We'll get into the pros and cons. Medigap, Medicare supplement. You wouldn't need a Medigap or a supplement if you were on Medicare Advantage. You would need it, highly recommend, if you do original Medicare. Well, why? Deductibles, copays, we're going to give you some charts and show you why. Benefit period. Ooh, this is important. So traditional Medicare, if you go into the hospital, have something done, there's a deductible that applies to that. You get out of the hospital, and for whatever reason, you have to go back in, have more care within 60 days. That's the number, 60 days. It's considered the same benefit period. So I go in and have a heart attack, I go in the hospital and I get that taken care of, and 50 days later I had to have a knee replaced. It's all the same benefit period, meaning only one set of deductibles apply to it. So if you think you're going to have some stuff done, you might want to plan it within 60 days. So you only have one deductible. We'll show you that. 60 days is what you need to remember there. Initial enrollment. When you turn 65, you're required to sign up. If you don't, and you sign up later, there's penalties, and I'm going to show you how those penalties are calculated. So you have 7 months, 3 months before your birthday, the month of your birthday, and 3 months after. You got that window. You miss it, you'll regret it. If you don't leave with anything else tonight, you need to leave with that. 65, you got to sign up. Now, if you're working for an employer, that's a difference, and we'll explain that too. Annual enrollment. Wait a minute, I got my initial enrollment, that's when you turn 65. Annual enrollment, every year, you have the option of picking a new supplement plan, doing Medicare Advantage, flipping back and forth. Please, every year, evaluate your coverage. Especially if you're on Medicare Advantage, if you just say, yeah, I like what I got, just keep it and keep going, well, they could drop your drugs. They can drop your doctors. So you want to look at that every single year. Don't just say, yeah, just keep it. Don't do that. Annual disenrollment. They give you a window. So the enrollment period, we'll get to the exact dates, is October to December. And that's for the next year. So you sign up, let's say you take Medicare Advantage, and you get into January 15th, and you go, you know what? I already know I don't like this. They give you through March 31st to unenroll Medicare Advantage to go back to traditional. Just one little window. Once you pass that, you're stuck. Open enrollment for Medigap policies. Okay, we'll talk about those dates. Special enrollment. There are special times you can do it. And then the outside enrollment. We'll talk about each of those. Here's the meat of the thing. There are 4 parts to Medicare. A, covers hospitals. B, covers your doctor's visits. I'm skipping C on purpose. And D is prescription drugs. You do not have to take D. You don't have to. But if you ever want it later on, it'll cost you. Okay? C encompasses A, B, and D, and then some. We'll get into that. You don't want Irma ever to come visit you. When Irma comes to visit, she stays for a year, and she costs you money. And I'll explain why. Co-payments, co-insurance, deductibles, those are all real things with Medicare. Medicare is not free. Part A can be free, but the rest of it is not. And the donut hole, it's not chocolate. Donut hole has to do with prescription drugs, where you pay a deductible, then you have coverage, and then about $4,000 to about $7,000, you don't have coverage. It's out of pocket. Then once you reach $7,000, it's covered. But there's a hole in there that you are laid bare, that you have to fund all of the cost. And we've got the numbers here. And they'll be sliding over the years. It'll change. Okay, questions on the terms? All right. All right. Healthcare costs, $3.8 trillion with a T in 2019. Expected to go up 5.4%. I actually think that's very conservative. Healthcare. Anybody here in the healthcare business? Anybody? Nobody. No nurses, doctors, anything like that. You? Nurse? Thank you for doing that. All right. So healthcare costs, you've seen them. The doctors want more money, right? Nurses, you want more money. Hospitals want more money. I mean, I don't see it going down. I think it'll go higher than that. This is crazy. Since 1999 to 2019, overall inflation has gone up about 45%. Health insurance premiums is $255. If you do the math on that, That's over 5 times. So it's 5-fold more than inflation. Health insurance premiums. How long have y'all been on Medicare Advantage? More than 2 years? Last year, you got a huge increase in the premiums. It was 140 something, now it went to 171. Huge increase last year. Probably to get well, I was reading just the other day though that the reason they had that huge increase is they had a new Alzheimer's drug and they thought it was going to cost X, and now they cut that in half, so now we may actually see a decrease in the premiums this coming year. Okay. So this shouldn't shock anybody. Seniors versus all ages. We're going to pay more for health care in our old age. That makes sense, right? The last 6 months is probably your most expensive health care than you ever have in your life. All right. You notice anything else funny on here? We were laughing at this as Daisy was going through it. Let's see. Look at here. Apparel. Obviously, when you get older, you don't wear many clothes.
You just don't have to wear the trendiest stuff.
And entertainment, we spend a little bit more on entertainment than most people do. So, all right, but healthcare is going to cost us more. There's going to be more expenses for us. All right, what is Medicare? Largest health insurance program offered by the U.S. government, serving more than 61 million people. Federally run program. Remember that. Federally run program. You have to sign up for it. They want your premium dollars even if you're not sick. That's how they're going to keep this thing afloat. Okay. Run by the Centers for Medicare and Medicaid Services. We told you that. CMS. Part of the Department of Health and Human Services. We talked about 4 parts. A and B. C, Medicare Advantage, all-encompassing. And Part D, prescription drugs. 4 parts. Keep that in mind. C is kind of the outlier. It covers everything. All right, here we go. A, this is what it covers. It covers your hospital stays, skilled nursing facilities, hospice, and home health. There's your home health question. Some, Part A. I don't know how much, but that's where it would be covered if you needed it. And it was doctor approved, the home health. A, if you have worked at least 10 years, is free. If you didn't work and your spouse had worked at least 10 years and you both are 65, then it's still free. So there's very little downside to signing up for A at age 65, unless you're still working. So let's say you're still working and you got health care through your work, and it's a qualified plan, meaning there's more than 20 people working there that are covered, and you're 65. Well, you could sign up for Part A. It's free. And then if you did need coverage for any of those, then your insurance at your workplace would cover the first dollar, and this could be used to pay your deductibles. Any reason why you, don't answer. Any reason why you would not want to do Part A if you're still working? This is where we have the music play. What if you have a health savings account, HSA? Health savings account is one of the best retirement programs. That's a whole nother discussion. But when you put money into a health savings account, it's tax deductible. You cannot contribute to a health savings account if you're on any part of Medicare. So if you're putting $8,500, $8,400 into a health savings account every year, and you're getting a tax deduction, and then you sign up for Part A, so it's free, I'm going to get it, boom, you cannot contribute another penny to your HSA. So it may not make sense for you if you've got good health care coverage at your employer. So don't just run out and do it without thinking about those options. Now, if you don't have an HSA, then there's probably not a downside that I can think of. Part B, again, Part A is free if you've worked at least 10 years. Part B, everybody pays currently $170.10 per month, minimum. It can be more. And we'll talk how that's Irma when she comes to visit. Yes, sir.
If I turn 65 and still working, do I still have to sign up for A?
No.
No?
If you work for an employer that has at least 20 people.
Sure.
So if it were me, I'd contact them and say, look, here's my health care coverage with X company. I'm not signing up. I just want to make sure you're aware of that. Because they know you're 65, right? So you just got to make sure that employer's plan qualifies as a qualified plan.
And how much do we pay in Part B?
Today, it's $170.10 per month minimum.
Would you still be subject to whatever penalties you're going to cover if you have the qualifying plan?
If you have the qualifying plan, no.
So once you leave that job 2 years later and sign up, you're good?
Now, there's a gap here. This is important. So let's say you're 65, you're working, they want to keep you there, and you like what you do. You work till you're 67. And it's a qualifying plan, so no penalties. But your employer says, you know what? You've been such a great employee, Dan. We're going to give you COBRA, and we'll pay for it. But it's COBRA. COBRA, they have to offer it for 18 months. I said, Dan, that's a good idea. I don't have to pay Medicare. I get COBRA. Okay. 18 months goes by, and then he signs up. Dan's going to get hit with penalties. COBRA is not a qualified plan. That's a nasty surprise. COBRA is not a qualified plan. So when you lose your qualified employer plan, you immediately get on Medicare. Immediately. Don't wait. Okay. Part B, $170.10, everybody, minimum. Doctors, outpatient care, occupational physical therapy. I'm not sure where, if you needed a wheelchair or you need devices like that, where that fits. It fits in one of these. I'm thinking it's A. My dad, I'm going to tell some stories on my dad. He came to live with me his last 6 months of life. And so I got real familiar with what's going on here. You know, they had his walker and his wheelchair and all that. Okay, any questions? A and B. Traditional Medicare, traditional.
Okay, so if you're working and you're covered, you talked about but you still have to contact Medicare, correct?
Have to? No. The reason I'd say I would contact them just to confirm that the employer that I have, their plan qualifies. If you read the information on it, it says if it's 20 or more employees, then it's qualified. I don't want to take their word for it. I want to talk to somebody there so they put it in their system that, hey, Mike Frost called, he's still working, he's not signing up because he works for X.
Okay, second question. You mentioned you have to work at least 10 years to qualify for Part A
To get it free.
to get it for free. Does that mean like if you worked for 10 years when you were a teenager?
Doesn't matter, as long as you've got 10 years of service, 10 years of paying in. And if you were married and never worked, and they worked for at least 10 years, you get to do it on their work record. Okay, good questions. So, A, free if you've worked 10 years. B, everybody pays $170.10 minimum. Okay? That's 2 parts of the 4 parts. Here comes the third part. You do not have to do, yes ma'am.
You don't have to take B. You have to take A, but you don't have to sign up for B.
Oh no, back up. So are you working?
I will be in September again,
All right, so if you're working, you don't have to take either one.
even though I'm not going to get insurance with the company.
Well, if you're 65, you don't have insurance, then I absolutely would sign up for it. Okay.
But I'm required to take B.
When you're 65, unless you're under a qualified plan, you are required to sign up for B. Not a whole lot of sense not to pick A since it's free. So if you don't have a plan at age 65, you have to sign up for this. Otherwise, you'll be sorry. And I'll show you why. So we got A and B, and now C. C is optional. You don't have to do it. My dad didn't take it till he was 87. There's a problem right there. But he was on a half a blood pressure pill. So versus paying, $30 to $50 for a plan every month, he just paid for it out of pocket. The government doesn't care, and I'll show you why. So, Part C covers, I'm sorry. I got ahead of myself. This is the Advantage. I'm coming back to that. We're going to go to D. D is prescription drugs. Okay? Now, not all plans are the same. The government does not sell this one. You have to go to a private insurance company to get this. Same thing with a Medigap plan. We'll come to that. So you got to go out and say, okay, I'm on this list of drugs, find out who sells it the cheapest price, and that's what you get. If you don't sign up for this, when you sign up for A and B, and at some point in the future, like my dad, he developed a lung condition, and at 87, one of his medicines was $500 a month. So like, we got to get on a plan. And we did. The plan was supposed to be about 30 or 40 bucks. But since he hadn't had it from 65 to 87, it was almost double. It was still better than 500 bucks a month for the medicine. All right, so C covers everything. And it does include vision, dental. Well, take that back. It can cover vision, dental, and hearing. And you hear these people on TV, Joe Namath and all those folks, says you can get this extra money and you get free food and get trips to the doctor. Some of those offer that. Medicare Advantage, Part C, is not offered everywhere in the country. If you lived in Wyoming, out in the middle of nowhere, you do not have access to Medicare Advantage. There's just not enough people there to have it. But every doctor has to take traditional Medicare. So you got to keep that in mind too. All right. So Part D, you don't have to take. If you want to risk it, don't take it. Otherwise, you need to sign up for it. Questions?
So Mike, on that one that you're talking about with your dad and that expensive drug, so we've got my mom on a Part D plan, but it's a really cheap plan. But what we do find is that some things that she has when she comes out of the hospital stay are very expensive when you go to the store compared to another plan that other mother-in-law's on that is on constant higher medications. So if you start with that low-cost plan, when you run into that high cost, is it easy to switch then and you don't have that penalty?
You don't have the penalty because you already had the plan. And where I thought you were going is, can I change it in mid-year? I don't know the answer to that question.
I
But
actually think you can change mid-year.
But this one for sure you can change every year at the enrollment period. So yeah, you can go from this low plan to this high plan.
And as an example, the plan we have her on is $6.40 a month.
That's it.
So cheap.
Yeah. But it only covers.
Doesn't cover certain medications.
Exactly,
I
right.
do all very well, but
Right.
she's not on it except when it comes.
Yes, sir.
Part D, is this where the Plan N, the Plan G, and all these things fall?
Not yet. No.
Okay.
This is strictly prescription drugs. Okay. Part A, Part B, and Part D, though, are all inside of Part C. We're going to keep going back to that. A, B, and D are in C.
Can I ask you another question
Sure.
about C? Long before I turned 65, I had all my older friends say, do not, under any circumstances, sign up for Part C. And I forget their reasoning. My notes are at home. So I didn't.
There's a lot of people feel that way.
Yeah.
But 40% of Americans are on it.
I understand. It's cheaper.
I've got a chart here. I'm going to show you the pros and cons, and we'll get to that. Yes, ma'am.
I'm a little confused. C is just called Medicare Advantage?
Mhm.
Okay, that is, C is not Medigap, Medicare supplement.
Correct.
Okay, so that's
Yeah.
that should be another letter.
So we're getting a little bit in the weeds, but it's a good distinction. If you have C, you don't need a Medigap or a supplement. You don't need it. I don't even think you're eligible to get it. Yeah, yeah.
But I thought C also covered D, Part D also.
It does. But Medigap and supplement is another, we're going to come to it. A, hospital, B, doctors, D, prescriptions, C covers everything. Okay? It's kind of got to get your head wrapped around that. You're either going to do what's called traditional Medicare, A, B, D, or you're going to do Medicare Advantage, which has all that wrapped up in it.
So how does the cost compare?
Ah, there's the key question, the cost. Hold that question, I'll get to it, okay? But that is the linchpin. All right, options. This will help depict it. A, B, and D, You're either going to pick traditional Medicare, A, B, and D, with the supplement, Medigap policy, or you're going to take Medicare Advantage, which has it all wrapped up in it. So let's just stop here for a second. So A costs how much? Free. B is $171.10 right now per month, minimum. I keep saying minimum because it can be more. Those of you on the other side of the room, I'll talk to this. So A is free. B, $170.10. We're not talking C, we're talking over there. Then Part D, prescription drugs, it can range from $6 to whatever.
150 or 160.
I'm going to say 50. Well, yeah, I'm going to say 50. I'm going to make the math harder on me. All right. But now I've got to add one more thing. The supplement, the Medigap policy. I call it Medigap. Okay? And it's usually at least $150 a month. So who can add that up? 170. So you got 200, 370. $370 a month. Per month. Okay.
Per person, right?
Per person. That's traditional Medicare. Medicare Advantage. Part C. So Medicare Advantage, Part C. How much is it? How much is A? Nothing. How much is B? Even if you have Medicare Advantage, you're going to pay that. How about D over here? Trick question. Nope, it's excluded. Medigap policy? Nope, it's included. Why wouldn't everybody do this? $370 versus $170. I can save $200. Why wouldn't everybody do this? Well, we'll find out. Lost my clicker. But that is the crux of the issue. How much am I going to pay? Here we go. Here's some cost. All right. IRMA. Remember I said you don't want IRMA to come visit? IRMA. Income-related monthly adjustment. So if you're a married couple and you make less than, if you have income of less than $182,000, that's all sources of income. If you sell a piece of property and have capital gains, income. Social Security, income. IRA money, income, except Roth. Roth income doesn't count. Everything else does. So at the end of the year, if you have $182,000 or less, you're going to pay the $171.10. Okay? Everybody pays that. But if you make $1 more, then you're going to be bumped here. All right, here's something that we were talking today. So let's say you're a married couple. Everything's going along fine. One of you passes away. And you're making, let's make up the numbers, $150,000. You're well under the number, so both of you are paying $171.10, but now one of you passes away, and your income drops to $120. Now it's one of you. So now you're doing the single. 120 is in this range, you're basically going to be paying double. Just because the spouse died. And your income taxes can go up because you lose half your standard deduction. Those are nasty surprises to have when you lose a loved one. So you just got to be aware of it. I don't have a solution for it, just live forever, I guess. Okay?
Does a life insurance policy count as income?
Does the life insurance policy count as income? Life insurance policy is tax-free, so no. Great question. So be aware of this. If you're $1 over, you're going to get IRMA come visit for a year. And then when you file that next tax return, if it goes down, then it goes away. IRMA. You don't want her to visit. Just remember that part. Okay. Questions on this? Yes, ma'am.
If we sell a house,
If you sell a house and you make a profit, does that count? You sure? Okay. So there's a rule that says married or single? Single. If she sells a house and she makes less than $250,000 on that sale, there's no capital gains tax, so there's no income. I'm not sure, but I don't think it would be. But if she made $500,000 on the sale, now she's got $250,000 of capital gains that absolutely would count as income, and you just blew it.
What if it gets reinvested in the house?
Then there's no taxes. But you can make up to $250,000 as long as you lived in the house at least 2 years, right, Mr. Tucker? And it's tax-free. Married couple can make $500,000.
And on that reinvestment question, you need to talk to your tax person, because there's a whole list of rules around that.
Yep. And we got a realtor sitting right here if you want to talk to him afterwards. He'd be glad to sell your house. He probably has 3 offers for your house right now. So. All right. So don't let this sneak up on you. And that 182 number, it adjusts over time, and it has been going up. Okay.
So you sell the house or whatever, you have that income for that year, then the next year, your income drops back down.
Then it goes back to what?
Goes back, okay.
Yeah.
So for 1 year, you might be paying that $544, but the next year it might drop to $170.
I have a client right here, sold a piece of commercial property, netted over $1 million. Yeah, he's out of luck. He's going to pay that for a year. But you know what? I'll pay this for a year for $1 million. So,
That's a pretty good trade-off.
yeah, that's a trade-off.
Cost of the sale of the property.
Yeah. Just don't get so close and you're just barely over it when you could have done a few things and stayed under. That's the key for this one. Other questions?
I see this as a 2020, does that adjust yearly?
Yes, ma'am, it does. All right. Original Medicare. A, B, D. That's what we're talking about. So Part A, remember? Part A costs how much? Free as long as you work for 10 years. But there is a deductible. You go in the hospital, you're going to get a bill for $1,556. You're paying that first before they kick in anything. Remember we talked about benefit period, that 60-day window? There you go. So if you have to go back in 60 days, you don't pay that deductible again. But if you go in day 61, starts over. Okay? First 60 days, you don't pay anything out of pocket. It covers it after you pay your deductible. From day 61 to 90, you owe $389 a day. That's a really nice hotel room. Okay? So this is where you need that Medigap policy to step in and cover these copays and these deductibles. All right? If you go to the skilled nursing home, go back to my dad. My dad had some stuff, and so he came out of the hospital, and they said, you got to go to rehab. All right? So the first 20 days cost nothing because it was prescribed. And by the way, you can't just walk in there and say, I wanted to go to rehab. You have to be prescribed by a doctor. Okay? But if he stayed in there past the 20 days, it was going to cost him $194 a day. Well, he had the plan that paid 100% of his deductible, so he never paid a penny after he paid his $170.10 per month and his Medigap policy. He never paid a penny out of pocket. That plan is no longer available. Okay? So you can see where this can add up. If you don't have a Medigap policy, you're in trouble. All right. Part B. Now this, everybody pays the $171.10, right? Unless you have IRMA visit, which would be more. But it has a deductible. Now, this is the government program. This one is benefit period. This one's per year. Make it consistent, right? Okay. So you're going to pay this up front. Just know you're going to pay that. And then after you pay this, you're going to pay 20% on everything else. So I'm paying 20% here, and I'm paying that much a day and that much a day. Well, I thought I had coverage. Well, you do, but you're going to be paying a part of it. So you need a Medigap supplement policy if you do traditional Medicare. This $150 I'm putting right here. Okay? Questions? Okay, we're going to see this slide again here in a minute. Medicare supplements. Okay. You cannot buy this from the government. You got to buy this from State Farm, Farm Bureau, United Healthcare, Aetna, somebody. The government doesn't sell these. Now, the good news is these are all the letters. Somebody asked the question earlier about the letters. So these are the letters. If you get a N policy, the letter N, from United Healthcare, it has to cover the exact same thing if you buy it from Blue Cross Blue Shield. They have to be apples to apples. What's different is the price. But when you say, okay, I want an N policy from Blue Cross, $100 a month. How about it from Aetna? What's $75? Well, I'm going with Aetna because it has to cover exactly the same. Okay? So it helps you cover the co-payments, co-insurance, and the deductibles. All right, let's see if we can look at a few of those. It may be a little hard to see, but I'm going to highlight a couple of them. Okay? So let's look over here. Part A, co-insurance hospital cost, up to 365 days. You remember earlier when you stayed in that long, how much the cost yours was on a per day basis? Well, after this is going to cover 100% of it. Man, that's what you want, right? You don't want those big surprises. So Plan G is going to cover 100% of that. Part B, co-insurance and co-payment, it's going to cover 100% of that. I'm liking this. First 3 pints of blood, well, I hope I don't need that. Hospice care. My dad went to hospice, never paid a penny. Skilled nursing facility. He went in for rehab. He paid nothing. Medicare Part A deductible. That deductible that we showed by each day, Part A. Part B, whoops. See it missing here? How much was it? $233 a year, so you're going to be out of pocket for that. Just that on Plan G. And then Part B, excess charges. You know, if your doctor charges an extra fee because he's a specialist and he charges it, Medicare pays X, this plan will pay the rest. Yes, ma'am.
I thought G was obsolete.
I think these two are obsolete, C and F. I think, okay? That's what they're telling me. You had to have this before 2020, okay? Because you see here, the F plan, it covered everything. And if you have it, you can keep it. But if you didn't have it already, you don't get it, okay? All right, and then the last piece here, foreign travel. Something you got to know on Medicare. If you go out of the country, you're not covered unless it's part of your supplement plan. Just know that. Inside the country, fine. One exception, if you're on the border of Canada and the nearest hospital is in Canada, say you're in Wyoming or whatever what is that, North Dakota up there, and the closest hospital is actually right across the border, then they will pay for that because it's the closest for you. Okay, that's the one exception. Okay, so Part G here, good plan. Part F's the best, of course, it covers everything. But so Part K, notice it only pays 50%. So which one of these is going to be most expensive, G or K? G, because it covers more, right? K will be cheaper, but doesn't cover but about half as much. So you have to decide what are you willing to pay. And all these, when you go to, we recommend you're going to go to 3 people. We don't have the names, that we're not here to give recommendations, but go to 3 people that will do this. Your information will be exactly the same. They'll put it in their whiz-bang computer, and they'll spit out, okay, here's the best plans for you. Go to 3 people, 2 of them should match up. You probably get 1 outlier. Well, your information is the same, it's what are they telling you. Now, these people are in it for a commission because this is an insurance product. Sold by an insurance agent. They're going to make a commission. If you buy Medicare Advantage plan, it's an insurance product. They're going to make a commission. They're going to make a commission whichever way you go. It's to their interest to do the right thing for you. Okay. Questions?
When I discussed this to sign up for a supplement, it was suggested to me to go with Plan N if I was going to travel domestically.
Just
That
domestically.
may have been strictly because of that company, right?
Could have
That
been.
coverage.
Yeah.
But it's just a commentary, and it's $98 a month.
Yeah. So and he's asking me to repeat this so I can get it on the. So plan in, they said it for you domestic travel.
Right.
Well, you're covered everywhere domestically anyway.
Well, it had to do with in-plan and out-of-plan.
Oh,
Like
okay.
that historical
Yep.
qualification.
Okay. Other questions on the different plans? Thing for you to remember. Plan in covers the exact same thing regardless of insurance company. It doesn't matter which insurance company you go to. If it's in, this is what it covers. If it's G, that's what it covers.
What's the difference between D and N?
D and N, this 80% on the bottom. Well, there doesn't look like there's a difference. Well, what is this right here? Plan requires a $20 copay. This one requires a $20 copay.
Also, the Plan B or Part B excess charges.
The N and D. But if I was sitting with someone, I'd say, okay, so it's 20% every time I go to the doctor. That's the difference here. Okay, $20. So that one should be cheaper because of that one N. Okay? But you really want to know what that total maximum out of pocket is going to be too. All right, I'm not an insurance guy. Ma'am?
That Plan C, is that Plan C the same as the Part C on the Medicare?
Great question. Well, no. Is this C the same as Part C Medicare Advantage? No. These are all Medigap supplement policies that go along with traditional Medicare, A, B, and D. It's real easy to, not confusing at all.
Not as confusing as the tax code.
Make a comment. If you haven't signed up yet, get a new file cabinet first of all. Because one of the things that, and if my passwords and URLs and usernames proliferated like rabbits. Okay, everyone wants a password, and you can't pay your bill on this. They link you to something else. Some you can sign up for an auto pay by credit card. Some you can't pay by credit card. Some are auto pay by check. Some not. I mean, they're all over the map. And I'm planning to change my plan in to a different company because it's just a pain to pay. Honestly, I haven't had to claim on it.
In is in, so it doesn't matter what company.
But it just, and the other thing, you know, we got her on socialized medicine coverage, found out what major I was, never heard of that before. But plans that are available in your immediate area, if you're gonna spend most of your time in Northwest Arkansas, well, there's certain schemes, you know, like Blue Cross is really good, and some of those things.
Yep.
Others, maybe they're more limited.
Right.
To where you can go.
So the plans are different depending on where you live. And so when we do this exercise in a minute, it's going to ask for your zip code. And it's going to give us the plans here. If you plan to live in New York, you should put the New York zip code in. So it's by zip code. All right.
Yeah, question.
Yes, sir.
What about snowbirds?
What about snowbirds?
Yeah.
Great question. So where do they spend their, where's the largest amount of time do they spend? It's what they call their home base. They got to spend at least 6 months in a day. That's considered their home. That's where this should be. And so if I'm the agent they're working with, I'm going to be checking, okay, this plan in, is it going to be good for you in Florida, if that's the snowbird? Now, Medicare Advantage, big difference. We'll get to that in a minute. But this goes with A, B, and D. Right here. A, B, and D, this is the Medigap policy. That's what we're talking about. It's going to cover all your deductibles at whatever percentages we're showing here. Okay? Got that? Sold by an insurance company. All right, this is that same slide I showed earlier, but now you get a sense of, phew, man, I do need that. I need something to cover these deductibles and the copays and the stays. That's 20% and that. You see why you need that in traditional Medicare. Okay? All right. Shifting gears now. Medicare Advantage. That's C, which includes A, B, and D. You don't need a Medigap policy in this one. That's what, like, man, that's just a no-brainer. I'll save money. Well, okay. These are all sold by private insurance. Aetna, Blue Cross, Blue Shield, whoever. They're all private insurance. The way it works is the company says, okay, Susan, you're going to go to Medicare Advantage. You're going to go with Blue Cross Blue Shield. So we allocated you this much money. We're going to turn it over to that insurance agent. And now we wash our hands of you. They take care of you. Don't come talking to me. I'm done. And now the insurance company says, okay, I'm going to do that. I'm going to do that for the whole room here. Now I got this pot of money. How do I best manage it and be efficient where they can make a profit and still serve you? So there's a profit motive in it for them. But it also saves you money if you only spend $170, $110. It could work for you. I told you, 40% of Americans have it. Some people hate it. Others love it. You like it? It works for them. Okay. So benefits vary in several ways. Many plans have low monthly premium, and you are responsible for the cost. So you would have this. This is Part B. Everybody pays that. And then some of them will have maybe pay $50 a month, $100 a month, depending on what kind of maximum out of pocket you want. We're going to look at a few of them here in a minute. Okay. So you might be responsible for some copays, some coinsurance, deductibles. Staying inside the network is big. If you're travelers and you go from here and you like to go out west and you go to Canada and Mexico and overseas, well, you're not going to get covered with this. This says, hey, you're in Northwest Arkansas, you can go to Mercy. That's it. That's all you get to go to. Oh, you want to go to Mayo Clinic? Not covering it. You got to be right here.
Is it kind of like an HMO?
Very much so, yes. You go outside of it, you dig in your pocket. But if you stay inside of it, it's a lot cheaper. And if your medicines are inside of it, it can be really cheap for you. But your doctors get dropped and your medicine get dropped anytime. So you always want to review this every year. So this is Medicare Advantage. So you got, it's called Part C. It's got Part D in there along with Parts A and Part B. So it's just all encompassing, like a smorgasbord, right? Cheaper. Well, let's see. Okay, so monthly premium. So now notice the words. It says Medicare Supplement. That's the one that's paying my deductibles, right? That's what we're talking about. So a Medicare Supplement does have a monthly premium. Could be $150, could be $200. Depends on which letter you pick. Medicare Advantage, some of them don't have any premium. Everybody pays a $170, $110, but above that, you may or may not have one, depending on how much coverage you want. Includes Part D and dental and vision. Medicare Supplement, no. Medicare Supplement is this. If you want Part D, it's separate. That's drugs. And there is no dental or vision in traditional Medicare. You have to buy a separate policy for that. It can be included in Medicare Advantage. Not always, but most often it is. Co-payments to providers. Yes, there are co-payments here. That one, you don't have co-payments. The Medicare Supplement pays for it. Okay? Out of pocket, up to $10,000. Not in the supplement plan, but you could have a maximum out of pocket up to 10 grand for this one. It's not looking so good now, is it? Restricted to networks and hospitals. Nope, you're on Medicare, traditional Medicare, you can go anywhere in the country, United States, you get covered. Here, you stay in Northwest Arkansas. You go outside of this, unless it's an emergency. You go to Yellowstone and a bison gores you, you get treated for it. Okay?
So Mike, not just in Northwest Arkansas, but in Northwest Arkansas, there are limits too. Skilled
Yes.
Facilities, for example, Humana, they cover
Four.
in Northwest Arkansas. 4.
So you will know when you sign up, this is what you can do.
Yes. And that changed after the sign-up.
And it can change any time on Medicare Advantage. Can you appeal a decision? You go in and say, I need my knee replaced. And Medicare Advantage says, no, you don't. You don't need it. You cannot appeal that. Traditional Medicare, you can. Okay? Can my plan drop my doctor? Every doctor has to take Medicare. They don't like it because they don't get paid as much, but they have to. Here? No. It's only when you're in the plan. Can my plan be canceled? Traditional Medicare? No. Medigap policy? No. This one? Yep. Not normally. What they do at the end of the year, they say, you know what? Northwest Arkansas, not profitable for us. We're not going to be in business here anymore, so go someplace else. That's usually what would happen. Ability to travel, see any doctor. I need to go to Mayo. Well, go. Over here? Nope. Oh, you can go, but you pay it for yourself. So now you see where the cost. Now, if you're really healthy and you've been healthy, you know, you could roll the dice and say, I'll just do this one. And then at some point in the future, if you do develop something, you can always switch on an annual basis to traditional Medicare. Now, ask the question, can they deny you taking, if you're on Medicare Advantage and you develop Hodgkin's disease, can you switch to this? Well, you can't do it in the middle of the year, but you can at the annual enrollment. But the supplement people do not have to take you. If you don't take traditional Medicare with a Medigap policy at your initial enrollment, and then at some point in the future you want to, they can require medical underwriting for your supplement plan, and they can deny you. When you sign up originally, they have to take you, regardless of your history.
So at initial enrollment, they have to take.
Everybody has to take you.
One, if you take the cheaper one and then as you're getting older, you think, well, and you switch over before you develop that, can they still cancel you because you didn't initially sign up for it?
You'd have to go through medical underwriting to get in, but once you're in, you're in.
Like if you're still healthy.
So if you're still healthy, you go through the underwriting like, oh yeah, we want her. She's healthy. And then 2 years later, you develop something, they can't cancel you. They cannot cancel you. But if you go from Medicare Advantage into traditional Medicare and you have a problem, you can be denied the supplement. Not A and B, but the supplement. Okay? So be careful of that. If you go visit these 3 people, and they say, yeah, you ought to go to Medicare Advantage, you ask the question, well, what about if I want to change? Do I still get my supplement plan? If they don't tell you that you have to go through medical underwriting, then you need to ask the question, because that is a hiccup that some people find out in the wrong way. Questions on this? All right. Okay, got Part D. This is your drug plan. Private insurance, just cheapest one that covers your drugs. That's what you want to do. All right, so you get the drug plan either with a Medigap policy or a separate one, standalone, that would be this, or it's included in the Part C. Okay, so how do you find out what's best for you? If you got your devices and you're hooked up to the website, we're getting ready to go in, check these out. We're not going to do this one, but if you wanted to, prescription drugs, this is where you would go, Medicare.gov. But we're going to go to Medicare.gov, period. Now, this is going to, I'm not going to go over all these numbers because they'll change annually, but this is the donut hole we talked about, right here. So 0 to 480 in this particular plan, you're going to pay. You're going to pay $480 a year for your medicines. Once you get to that, from 480 to 4,400, it covers it. Now, if you still need more medicine, from 4,000 to 7,000, that's the donut hole. You're completely exposed. That's coming out of your pocket. But then if you still need it after 7,000, cancer treatment, then you get covered under catastrophic coverage. It covers it from there on. But that donut hole could be hard on you, so just know that. All right, you about ready, Ashton? All right, now we're going to go online. And I'm going to show you, Ashton's going to show you how to do this. So this is the website. Now, I struggled with this when I first got, I was like, man, I don't want to put my information in here. And after I talked to somebody, I figured this out. So Medicare.gov, not .com, .gov. So you want to go to find health and drug plans. All right, so now this is save time and log in. We're not logging in. We're not putting any of our information in. I just want to get some info. So we're going to say continue without logging in. Okay? And so now we put our zip code in right there. 72712. If you lived in New York, you'd figure out that one. Okay? And so we want to learn more about Medicare. Yeah. So you can't just go to prescription drugs. You can do different plans, but we want to know. Now, Medicare Advantage, Part C, everything, what's available. Or traditional Medicare. Let's do Medicare Advantage. This is the one that's supposedly cheaper, but let's see what that would be. All right. All right, let's go to, we got Medicare Advantage. So hit that right there. Yep.
Can you go back?
Oh, I'm sorry.
At,
Sorry.
health and drug plans?
All right.
How did you
Keep
do
going back. One more. Right here?
We didn't get that. How did
Back up one more. So we start right here.
oh,
Find health and drug plans. Sorry, I should have asked if we're together. Everybody here?
Yep.
Got this spot? Anybody need
yeah, got it.
zip code? And then we're going to do the all. I want to learn more about Medicare. All right, right here. If I knew I wanted to do traditional Medicare, I'd go here, and it would have those supplement plans too, but we're going to go here. Again, Medicare Advantage is sold by an insurance company. So all these insurance companies have to load this information up. Okay, Medicare Advantage plan, it's that right there.
That's just a little drop down.
All right. Okay, here we go. All right, so Medicare Advantage. What do we want to know? Drug plan, Plan D, Medigap. We don't want Medigap. This is Medicare Advantage. So we're already got Medicare Advantage clicked. So we'll go to next. All right, cost. Do you get help with cost from any of these programs? We're going to say no. We want the worst case scenario. Tell us your preference. Do you want to see drug plans when you compare plans? Yeah. Now it's going to ask you, what drugs are you on? So some common drugs people use, Lipitor for cholesterol, right? So put Lipitor in. If you have some heart issues, what's a heart drug? Metropolol. I've been on that. That's no fun. Metropol. It should pop up and give you an option. Metropol.
I don't think the O's for the R's first. I think it's
METO. METO. Well, you got to know how to spell the drug before they'll pop it in there for you. Let's do Eliquis. I know how to do that one. So, ELQU. I was on that for a while. Well, that's not even QUIS. Yeah. Is that it right there? Yeah. Okay. Well, we'll put in 2 drugs. Anybody else want to throw a drug in? Don't say marijuana. Okay.
I can spell Metropolol.
You can. All right. Let's add it. Put Metropolol in there. All right.
MET, O-R, or O-P, I'm sorry, R-O-L-O-L. Yeah, it's
There you go. Right there. Okay. All right. So now we got a few drugs, and so you put in what you take. It doesn't know who you are, male, female, where, any of that, but you put in what you take. All right. All right. So just put Walmart. Just pick one of those. It doesn't matter. Okay. So now it knows what drugs you want. And now it says, okay, here's what we got. Cigna has one here. Again, this is A, B, and D, all wrapped up into one. And it says your premium drug cost out of pocket be about $210. This is going to cover vision, dental, hearing, transportation, let you go to the fitness center, worldwide emergencies if you're traveling, and telehealth. That sounds pretty good. All right. Let's see. Let's hit with 0 monthly premium. You got to pay the $170.10 for the Part B, right? Everybody pays that. But then you get all this other stuff, no cost. Your drug's going to cost you $210 a year. That's your deductible. And you're going to have up to $6,700 of in-network total out-of-pocket. So if you don't normally go to the doctor, and you've got $6,700 sitting in an account somewhere, and you want to keep your cost low, this might work for you. I said might. I don't know. We'll scroll up, see what the next one is. That one's got a zero deductible. Okay? And it's got less in-network cost. No transportation, though. Oh, shoot. Okay? Let's see if we can find one that has any kind of a payment with it. Let's just stop right here.
So when you say it doesn't have transportation, what does that mean?
Right here. They'll come pick you up, take you to the doctor.
Oh.
So this is how you can look before you ever go talk to an insurance agent. Because you see, these are all different plans. WellCare, we had somebody else, Aetna. They don't know who you are. So you can have an idea before you walk into there and stick a hook in your mouth and we got one. You walk in educated. Okay? All right, let's back up and do a traditional. There you go, right there. Yep. All right. Just click both of those. We want to see all the cost. All right. Medigap policy. Oh, we got that already. Okay. All right. You get help? No. We'll keep the same drugs. Yep. Pick a farm. Yeah, it was Medigap and drug. So we got both of them. Okay? Pick a pharmacy. All right. Here we go. So now, you're going to pay $171.10. Everybody pays that. And now for a drug, we're going to pay $57.90. We guesstimated $50. And you're going to pay out of pocket $524. But I don't see the, it doesn't tell me what letter. It doesn't tell me about my, my letters, my Medigap policy on that one. Okay. Oh, you know what? This is lowest drug. So let's click on this. Lowest yearly drug, no, lowest monthly premium. But it's still not showing me my, Yeah, click on that. Let's see. All right, come on down. Interesting. It's just showing me the drug plans. It's not showing me the letters, the plans. Okay, we probably didn't do the right thing. But so you get an idea. You can go in and play with this. And you don't have to worry about somebody knowing your stuff. Okay? Questions on this? Medicare.gov. All right. So, Medicare, you got to be 65 or have some disability. Your spouse can't be 65 and you 62 and get Medicare because they're 65. You got to be 65. Okay? Okay. You may be eligible through your spouse. That's what we're talking about, Part A here, getting it free. But you still got to qualify by age. You still got to be 65 or be disabled. Okay? You may also qualify Medicare Parts A and B if you're under 65, again, with a disability. All right. Automatic enrollment. We like this. How do you do that? If you're on Social Security, when you turn 65, you don't have to worry about signing up. You're signed up. And they take the $171.10 out of your Social Security. You don't get a choice. They're going to get their money. Okay? Or if you work for the railroad. Railroad has these special deals here with pensions and things like that. So those two, you get automatically enrolled. All right. So initial enrollment period. We talked about this. Mailed 3 months before you're 65. They're going to send you this. No John Smith's in here, is it? We got your stuff. You protect this like your Social Security number. All right, IEP. This is that 7-month window I talked to you about. 3 months before, the month of, and 3 months after your birthday. That's when you get an opportunity to sign up. You miss that, and you're not working for a qualified plan, bad things happen. Annual enrollment period. Every year this comes around. And the people that sell this stuff are slammed for this 2.5 month period. I mean, they're just covered up. So if you're going to be turning 65 or already 65 and you're thinking about changing plans, don't wait. Go ahead and make an appointment. Go visit with the folks and get an idea, get in their system, know what's going on, and then when the time comes, it's pretty simple. But if you wait until this time comes and you try to make an appointment, they're going to cut you short. So pre-plan it. Okay? So between October 15th, December 7th, you have to sign up. That's your annual. If you're on Medicare, then you sign up, whether Advantage or traditional. This is the time you sign up every year. And this is when you can change plans. You can change your supplement. This is that redo. Oh, shoot, I didn't want Medicare Advantage, I want traditional. Between January 1 and March 31st, they let you undo it. You go to, April the 1st, too late. Okay, been talking about penalties. All right, Part A is free. But if you're one of those that haven't worked 10 years and you're paying for it, and you're like my dad, you waited to sign up for something, then on Part A, whatever your monthly premium is, say it's $100, and you wait, well, you're going to get charged 10% of that as a penalty for waiting. Very seldom happens because most people get it free. All right. But what if you don't sign up for Part B? $171.10 times 10%, $17, times the number of years you waited to sign up. So, if you waited 5 years, that's $85, right? We did this earlier, that's the only way I know it. So that's $85 on top of my $171.10 for life. For life. They're serious about you signing up. They want that premium money. You can't wait till you get sick to sign up. You can, but you're going to regret it. Okay? Now, the next one's going to be even different. Part D, prescription drugs. My dad, from 65 to 87, no problem. 87, he needed it. We signed him up. Monthly premium times 1% of the premium times the number of months delayed. Months, not years, months. And you pay that the rest of your life. Well, he only lived another year, so that was beneficial in that part. Bottom line is, don't wait. If you're not working for an employer that has a plan, you turn 65, get on it. Questions? Medigap. These are the supplements, okay? Start of the month for your Medicare Part B effective date and lasts for 6 months. You're guaranteed issue regardless of health status. On your initial period, when you turn 65, they have to cover you. Special enrollment. That would be if you work till you're 68 and decide, okay, now I'm going to sign up. That would be a special enrollment because you had qualifying coverage. Not all plans are guaranteed issue under special enrollment. So that means you've got to go through underwriting. And if you're healthy, no problem. But if you're not, that's a problem. Outside enrollment must pass medical underwriting, no guaranteed issue from any insurance company. Now, I don't know when that would take place. I don't have an example for that. But just know if you don't do it when you first sign up, you're subject to medical underwriting. If you're healthy, no big deal.
So if I turn 65 and I'm still working,
let's say 6 months later I retire. That's a special thing, and I might have to go through underwriting to get the supplement.
Might, right, might.
But also doesn't, when I did that same thing, I worked till 67, I went to my company and the HR department had a form that I could send in to them showing what I had been working for those 2 years before I retired.
Yeah. So
There's
that
actually
means,
a form you can actually get to send in to prove that you didn't need it at that time.
so the difference here is, that you're saying is, you had a form to prove that you don't have to pay the penalty.
Right.
The form, I don't believe, prevents you from having to go through medical underwriting.
Right.
You don't have to pay the penalty with the form.
I didn't have to go through an underwriting.
Well, you're probably healthy. You're still healthy. So, well, you're just now 65, right?
We 70 this year.
All right. So, questions. If primary insurance does not cover a service, how do you get it submitted to Medicare? All right. It's a difficult question. So, this assumes you're still working, or you wouldn't have primary insurance.
Correct.
So, if the primary insurance doesn't cover it, then the only thing you have if you're still working is Part A, which would be hospital coverage. Not doctors, just hospital. So it probably wouldn't work.
What about for you?
For example, if the chiropractor's office doesn't take,
Chiropractor.
Okay, and so he doesn't submit it to insurance, and then he said, I can't pass it on to Medicare, because they'll deny it.
Yep.
There's no way around this.
So chiropractic care. That one, you would have to check your supplement plan to see if it covers chiropractic care. And if you do Medicare Advantage, you'd want to know, does it cover chiropractic care? Not all of them do. Not all of them cover acupuncture. Some of them will. They'll probably cost more. But if it's a medical necessary, doctor says you've got to have surgery on your gallbladder, they can't deny that. All right, how do I find the best Medigap supplement policy? Well, go to 3 people. Offline, I won't do it in a crowd, but offline I would tell you, here's the 3 I would suggest, based off of feedback from our clients. Okay?
And when you say 3 people, you mean like State Farm or Aetna or something like that?
Nope.
Okay.
I would mean, and you've seen TV commercials, that people that's all they do is Medicare coverage.
Okay.
I would go to 3 people like that.
Okay.
3 different, and you don't care, you want the most coverage for the least amount of money. And if you tell it to 3 different people, it should be pretty simple. So this person may only sell these 2 insurance companies, this one may sell these 3 insurance companies, this one may sell 3, 4 different. You don't care. I just want the best price. Eye, ear, dental, chiro, acupuncture. That would all be either Medicare supplement or the Medicare Advantage plans. Traditional Medicare doesn't cover any of those, I don't believe. A and B doesn't cover that. Is there a gap in coverage with traditional and Advantage? Going from traditional to Advantage? Is that the question?
No, there's, when I switched from regular insurance to.
Oh, got it, yeah. So, no. So when you leave your employer, let's say, how old are you?
I'm 64.
64.
And I'm retired, and I'm on Social Security.
You're on Social Security right now, and you're retired, okay? And you're on, I'm assuming you're on Cobra?
No, I'm
On
Blue Cross Blue Shield.
through Arkansas Exchange?
Yeah.
Okay, so you have private insurance, and then you go from private insurance to Medicare. Is there law? No, there's not. But your key, you got to make sure when you sign up, you know when it kicks in. So I wouldn't stop paying on this one until I knew Medicare had me covered. Questions? All right. Can Medigap or Advantage deny you at initial enrollment? No. Initial enrollment? No. They got to take you. They don't have to take you after the initial enrollment, but initial enrollment, they got to cover you. Does Medicare provide home health coverage? Well, the Part A has some home health. I don't know what limits or anything like that, but it does cover some. Now, notice none of these we talked about tonight cover nursing home care. Zero. Now, if you have to go to rehab in a nursing home, that's considered rehab. That's different. But if you have to go to a nursing home because you can't take care of yourself or whatever, Medicare does not cover one iota of that. Zero. Okay? How early can I get coverage? 65 or have some disability. Okay? All right, summary. Everybody has to sign up. I don't care who you are. You got to sign up or you're going to pay a penalty later on. So sign up. 4 parts. A, free. B, everybody pays $170.10 or more based on your income. D, prescription drugs. Those 3 usually go together with a Medigap policy. Or C, which covers everything. Don't get suckered in with C just because it looks like, oh, I got lower monthly premiums. You got to know the big picture. What's my total cost could be for the year, okay? Know when to sign up. Initial enrollment, 65th birthday, 7-month window. Annual enrollment, October 15th, December 7th. Don't wait till October 15th, go talk to someone. Get there early, go early, get them in your system and pick one before then. Annual disenrollment. You picked a Medicare Advantage plan, you don't like it, you can undo it before March 31st. And that's it. Yes, ma'am.
How early would it be for October 15th to December 7th? How early will these people know?
Now, I'd call them. Because what they'll do is they'll put you all in the system, and they may not know the exact amount, but once they figure out you and what you need, and you decide it's traditional with a Medigap policy or Advantage, they say, okay, you can't sign up for it at that point, but they have your information in. So then when October 15th comes, you have an appointment on the 16th, they've got you in, as they rerun the numbers, boom, this is what's best. It just saves time and effort, and it helps them out, because they're going to be in a crunch during that period of time. Yes, sir?
Is it ever beneficial for one person to have one policy and his wife to go a different route?
Great question. Question is, should one of you be on traditional, one on Advantage? The answer is we have clients do that all the time. Why? One, really healthy, doesn't want to spend a lot, so they do it Medicare Advantage. The other one, got lots of issues. They need the Medigap policy to cover the deductibles, so they choose that one. So yeah, it does. And there's no group policies. Everybody stands on their own. All right. Come on, here we go. Medigap, we talked about those. You got to know what works for you. And just because it works for you doesn't mean it's going to work for you. Everybody's different. You got to plug your stuff in and know what your situation is. Get ahead of it. We've talked about that. Every year, please don't be lazy. When it comes around, you got to go talk to whoever you get. You're going to get a supplement plan or you're going to get Medicare Advantage. So you're going to talk to an insurance person one way or the other. Don't just get the renewal, okay, I'll just keep it. Don't do that. Go back and talk to them. See what's different. And make sure what you have is what you think you need. My dad never did that. I attempted to change it, and I can't tell you the words he used. Okay. All right. Those are resources we went there. Medicare.gov. Okay? Go there. Use it. Play with it. I like to blow up their system. Just you guys going to it. Yes, sir.
It's one thing that is a big differentiator is if you're taking Social Security or if you're not, and how you pay.
Great question. The question was, how do you pay specifically the 170.10? So if you take, let's say you decide you're not taking Social Security until you're 70, but you have to take Medicare at 65. Well, how do you pay for it? You got to write a check or they debit your account. But if you turn Social Security on at 62, when you hit 65, they're logging you in because they already got you in. They know you're 65, and they're going to start taking it out of your Social Security. You don't have to worry about that part. Now, Medigap, they don't do that. You got to pay that yourself. Prescription drug, you got to pay that yourself. But Part B, if you're on Social Security, they're taking it. They're getting it out of Social
If
Security.
you're paying on your own, it's quarterly, not monthly.
Oh, is it?
Yeah,
Okay.
it's a big number.
If you're not on Social Security, are you paying like the B part, are you paying the federal government separate from the Medicare?
Great question. So the question is, if you're not on Social Security, do you pay the government Part B on traditional? Now we're talking about we're on traditional. Well, either way, traditional or Advantage. You pay the government Part B, you pay the insurance company these two. So you'd be writing maybe 3 checks. Good question. Yep. But if you're on Social Security at 65, they're taking Medicare out of your check before you even know it. Can you use HSA to pay any of this?
No, because if you're on you said earlier, if you're on HSA, you can't contribute as soon as you get on this.
That's different.
Yeah, that's different.
You got an HSA pot of money, 15 grand, and now you're on this. We're using this right here. Can you use your HSA money to pay these? Trick question.
Yes.
It's yes and no. You cannot use it. You cannot use it to pay this. And they're going to take this out of your check. But you can pull money out of the HSA for your Part B premiums to reimburse. So if you have an HSA, you got to know that. Which one of these can I use to pull out? Your CPA or whoever does your taxes can help you with that. You can use it for deductible copays, buying anything that's not covered. If you need to go to the dentist and you're not covered, you can use your HSA for that. Okay. We got all your questions answered. Did anybody here not learn at least one thing? Because I've got something I can share with you that I'd make sure you walk out of here with something. Everybody learned something? Okay, we got our goal.